The organization is called the Indiana Community Health Workers Association, and the executive director, Margarita Hart, is with us this morning, and we've been talking about disparities in access to health care, particularly for minorities. Tell me about the role that your organization, the health workers, have in trying to change that dynamic.
Sure. So Indiana Community Health Workers Association is an association for community health workers. A community health worker is someone from the community that already understands the disparities in the community, and they're there to advocate for their patients. So they're the ones that go with different individuals from the community to their healthcare appointments and help them access transportation, medication, and kind of adhere to their care plan. So they're very successful at encouraging the patient to get better and to just be healthier.
Now, this kind of work, important work, is not cheap.
Right.
We've got to fund these health workers, correct?
Right. And because they are hard to fund, the employers don't understand how to get return on investment on it. But they're out there and they really make their outcomes better. So we need to have more. We have grants right now. A lot of grants are the ones funding for these workers, but we need to have more funding to employ these community health workers. They make a difference in the public health, so it's important.
And beyond Medicaid reimbursement.
Beyond grants, beyond Medicaid reimbursement, because they're so needed, especially in COVID recovery with minorities. There's not enough individuals to really help them through the recovery of COVID and the many disparities that were opened up. Really, we opened our eyes to the disparities during COVID, and these folks can address those.
I'm wondering what challenges we're facing now in terms of getting people to do this kind of important work, recruiting the kind of talent that does this.
Right. So right now there's a HRSA grant out there to train individuals that are natural helpers and train them to be community health workers. And the challenge is really for the clinics and the hospitals to understand where is the return on investment for this individual that works in my staff. And the results come from patients that adhere and the payers that are reimbursing for the wellness of these patients. So that's where the hurdle is, helping employers understand how these are critical part of their team. So that's our challenge as an association, is helping employers understand that.
Well, we hope we've played some small part in getting the word out this morning.
Thank you. Yeah, thank you for having us.
She's Margarita Hart.